Welcome back, everyone. Ready to dive into another fascinating medical topic with me?
Absolutely. Always ready to explore the intricacies of the human body.
Well, today we're tackling a real surgical marvel. How do surgeons know they've successfully removed a problematic parathyroid gland? These glands are tiny, but they play a huge role in regulating calcium in your body.
Right, we're focusing on primary hyperparathyroidism. That's when one of these glands decides to go rogue and overproduces this key hormone, PTH.
And the only real fix for that is surgery. But here's the catch.
You definitely don't want to remove a healthy gland by mistake.
That's where the magic of PTH monitoring comes in. But before we get into the nitty-gritty of how that works,
We should probably make sure everyone's up to speed on what these parathyroid glands are all about.
yeah, a little parathyroid 101. So where do we even start? What are these things?
Okay, so you've got four of them, usually tucked away behind your thyroid gland in your neck. Think of them as the body's calcium control center. They produce PTH, which acts like a thermostat, making sure you have just the right amount of calcium in your blood. Not too much, not too little, just right.
And calcium is kind of big deal, right? I mean, it's not just about strong bones, is it?
Oh, not at all. Calcium is essential for practically every cell in your body. It helps your muscles contract, including your heart, transmits nerve signals, helps your blood clot. It even plays a role in hormone release. It's like the unsung hero of your internal systems. Keeps everything running smoothly.
Okay, I'm getting a whole new respect for calcium now. So back to surgery. How did surgeons even figure out this PTH monitoring thing? Was it always part of the procedure?
No, not at all. Before this technique came along, surgeons had to do a much more extensive exploration of the neck, searching for all four parathyroid glands and visually inspecting them.
So like a much bigger deal, more invasive.
Exactly. Larger incision, more time under anesthesia, longer recovery for the patient. It was a whole thing.
PTH monitoring really revolutionized the field then.
Completely. It allows for a much more focused, minimally invasive approach. Surgeons can target the problem gland directly, minimizing disruption to surrounding tissues. Win-win for both the surgeon and the patient, really.
Okay, so we've got these tiny glands, this powerful hormone with a short fuse, and surgeons using it as a real-time guide during surgery. It's like a medical detective story where PTH is the key clue.
I like that analogy.
So let's break down the actual protocols surgeons use to solve this mystery. How do they use PTH monitoring to make sure they're getting the right gland?
Think of it as two main approaches, each with its own set of steps and advantages.
Okay, two main ways to be a PTH detective. I'm ready to learn the secrets. What's the first method they use?
One of the most common is what we call the 50% drop protocol. The surgeon takes a series of blood samples at very specific times during the surgery.
Let me guess. Before they even start cutting.
Yep. Before the incision, right before removing the suspected gland, then 5 minutes after and a final sample at 10 minutes. They're looking for a significant drop in PTH levels, ideally more than 50%.
So if those levels take a nosedive, that's a good sign.
Exactly. It signals that they've successfully removed the overactive gland, the one causing all the trouble.
It's all about analyzing the trend then, watching those PTH levels plummet after the gland is out. Kind of dramatic.
It is. It's like watching a stock ticker. Except instead of tracking market fluctuations, you're monitoring the body's response to surgery in real time. And for the patient, knowing that the surgeon has this immediate feedback can be incredibly reassuring.
Oh, for sure. That makes a ton of sense. Takes away some of the uncertainty of surgery. Okay, so that's the 50% drop protocol. What about the other one? How does that work?
The second approach is called the normal range protocol.
Ooh, intriguing name. Lay it on me.
In this one, the surgeon takes a blood sample before the incision, removes the suspected gland, and then waits 10-20 minutes before checking the PTH level again.
So, a bit more waiting involved with this one.
This time, they're looking for the PTH to not only drop, but to actually fall within the normal range.
Ah, so it's not just lower. It needs to be back to where it should be. A double check system. I like it.
Precisely. It provides an extra layer of confirmation that the right gland has been removed and that the remaining parathyroid glands are functioning normally.
These protocols sound pretty straightforward, but I have a feeling things aren't always so clear-cut. What happens when those PTH readings aren't so obvious?
That's when the real detective work comes in. There are definitely situations where the PTH levels might not behave exactly as expected, even if the surgery was successful. Surgeons need to be skilled in interpreting these variations and understanding the potential pitfalls.
So it's not just about following a set of instructions. It's about using your expertise and judgment to analyze the data.
Exactly. The PTH levels are a vital piece of the puzzle, but surgeons also consider the patient's overall clinical picture, their symptoms, and their medical history when making decisions during surgery. It all ties together.
This is so fascinating. It's like a combination of science and art. Now I'm really curious about those times when the PTH readings are a bit misleading. What can throw things off, and how do surgeons navigate those trickier situations?
Well, that's a perfect segue into part 2 of our deep dive. We'll explore the concept of false positives and false negatives, and how surgeons use their expertise to decipher those confusing results and ensure the best possible outcome for their patients.
Ooh, sounds like we're about to enter the advanced course in PTH detective work. Can't wait.
Welcome back to our parathyroid surgery deep dive. Last time, we really got into the thick of it, exploring how surgeons use PTH monitoring during surgery.
Right, it's like having a real-time guide, making sure they're removing the right gland.
And today, things are going to get even more interesting. We're talking about those times when the PTH data isn't as clear-cut as we'd like.
Exactly. It's like when you think you've solved the case, but then a new clue pops up and throws everything off. Ooh, I like that. So we're talking about those false positives and false negatives you mentioned, where the PTH levels might not tell the whole story.
You got it. Let's start with false positives. These are situations where the PTH levels drop during surgery, just like they're supposed to.
So everything seems fine, right?
Right, but the patient still has symptoms of hyperparathyroidism afterward. It's like the body's sending mixed signals.
Okay, now that's unsettling. What could cause that kind of misleading result?
One possibility is something called a parathyroid carcinoma. It's very rare, but it's a cancerous tumor of the parathyroid gland that can produce super high PTH levels, even after the tumor's been removed.
So even though the surgeon gets the tumor out, those levels might initially drop, but then rise again later because of those cancerous cells.
That's the idea. Thankfully, like I said, those parathyroid carcinomas are super uncommon.
Okay, well, that's good to know. What about other reasons for a false positive?
Another scenario is an inherited disorder called multiple endocrine neoplasia, or MEN for short.
And I feel like I've heard of that.
Yeah, it's a group of genetic conditions that increase the risk of developing tumors in various endocrine glands, including, you guessed it, the parathyroid glands.
So if someone has a family history of MN, they're more likely to get this kind of wonky result.
Exactly. Genetics can play a big role in these situations.
It's amazing how our genes can have such a huge impact on our health. Okay, so we've talked false positives. Let's move on to those false negatives. Those are actually more common, right?
They are. A false negative is when the PTH levels don't drop as expected during surgery, even though the surgeon got the right gland. Is like the PTH is hiding.
Like it's trying to trick the surgeon.
In a way. One of the most common reasons for this is simply the timing of the blood draw. Remember, PTH has that super short lifespan. If the blood sample is taken too soon after removing the gland, those PTH levels might not have had enough time to drop significantly.
So it's all about timing.
To a certain extent, yes. And it's not just when the blood is drawn, but also where. If the sample is taken from a vein that drains directly from the area where the gland was removed, that PTH level might be artificially high.
Ah, I see. So the blood needs time to circulate and mix for a more accurate reading. What about that PTH spike you mentioned earlier? How does that play into all of this?
Right. Sometimes when the surgeon is handling the gland during surgery, it can cause a sudden burst of PTH to be released into the bloodstream.
Like if you squeeze a sponge, some of the liquid squirts out. Makes
Correct.
sense. So if they happen to take a blood sample right at that moment.
It could give a misleadingly high PTH reading.
Yep. So it sounds like surgeons need to be really on top of their game when it comes to interpreting those PTH fluctuations.
Absolutely. They don't just rely on a single PTH measurement. They look at the overall trend of the PTH levels over time. It's like piecing together a puzzle, considering all the clues.
Definitely sounds like detective work to me. But even with all these precautions, there are still potential risks and complications with parathyroid surgery, right?
Unfortunately, yes. No surgery is completely without risk, even with all the advancements we've talked about.
So for folks listening who might be facing this surgery, what are some of the complications they should be aware of? What could potentially go wrong? We're back for the final part of our parathyroid surgery deep dive. If you're just joining us, we've covered a lot of ground already.
Yeah, we've talked about how crucial these little glands are, how surgeons use PTH monitoring during surgery.
And all those tricky moments when the PTH readings are a bit, well, mysterious.
Exactly. But now we're going to shift gears a bit and talk about what the future holds for this type of surgery. Things are getting pretty high-tech.
Ooh, high tech is my favorite kind of tech. So what's on the horizon? Robot surgeons taking over.
Not quite robots, but definitely some incredible advancements in development. One big area is minimally invasive techniques. These are becoming more and more common.
Minimally invasive. So smaller incisions, faster recovery.
You got it. Think teeny tiny incisions, sometimes even just a single keyhole opening.
Wow, so no more big scar across the neck.
Nope. Surgeons use specialized instruments and an endoscope, which is like a tiny camera. Gives them a magnified view of everything.
It's like they're looking through a microscope right inside the body. But with such tiny glands and delicate structures, doesn't that minimally invasive approach make the surgery even harder?
It definitely takes a lot of skill and specialized training. Experienced surgeons often use intraoperative ultrasound and advanced imaging to guide them, but the benefits for the patient are huge.
Less pain, I'm assuming.
Definitely less pain. And the recovery is much faster. Some patients can even go home the same day as their surgery.
No more extended hospital stays. Sign me up. What about scarring? Is that minimized too?
Absolutely. The incisions are so small that the scars are usually barely noticeable. It's a win-win all around.
Okay, I am thoroughly impressed, but I have to ask, what's next? What's coming down the pipeline for parathyroid surgery? Are we talking robot surgeons and AI anytime soon?
Well, while we're not quite at the robot surgeon stage yet, researchers are working on some amazing things. They're developing even faster and more sensitive PTH assays for even more precise monitoring. Imagine getting instant feedback on those PTH levels.
So that would be mind-blowing, like a live stream from inside the body. Are there any other futuristic advancements you're particularly excited about?
One that I think has huge potential is continuous PTH monitoring.
Continuous, so not just taking blood samples at certain times.
Exactly. It would provide a constant flow of PTH data throughout the entire surgery.
That sounds incredible. Why is that so beneficial?
Well, surgeons would be able to catch even the tiniest changes in PTH levels, which could lead to earlier detection of any problems. And that means they can make even better decisions during surgery.
It's like having a constant pulse on what's happening. Okay, I officially feel like I'm living in the future. It's amazing to think about all the possibilities.
It really is an exciting time to be in this field. As technology keeps advancing, we can expect even more incredible innovations that will improve patient care and push the boundaries of what's possible in surgery.
Well, that brings us to the end of our parathyroid surgery deep dive. We've learned so much about these tiny but mighty glands and how technology is revolutionizing the way we treat them. It's been quite a journey.
I hope you all found it as fascinating as I did. It's truly incredible what medical science is capable of these days.
Absolutely. And as always, the more we understand about our bodies and the latest advancements, the better equipped we are to advocate for our own health. So keep asking questions, keep learning, and keep exploring the fascinating world of medicine. Thanks for joining us on this deep dive.